Northern Italy is the richest part of Italy. It's not some backwater when it comes to advanced medicine or advanced anything. I mean, that's where they make the most expensive yachts in the world. That's literally where they make Ferraris. And there are big modern hospitals there full of lots of fully qualified doctors and world-class equipment. And that place is where they are now losing more than 300 people a day, 475 deaths in the last 24 hours. Reporter Chico Harlan wrote this up today for the Washington Post with the last line that'll put your heart in your throat. Quote, even as lockdown measures have gradually slowed the number of new cases, the country's death toll has exploded, more than tripling in the span of a week. Italy's death toll is increasing exponentially in a way that mirrors the growth of total cases earlier this month, as people lose battles with the disease after several weeks. Today, the governor of the hardest-hit Lombardy region, Attilio Fontana, said that medical facilities there will soon be unable to help the sick. Quote, we will soon be unable to give a response to those who fall ill. We will be unable to give a response. What he means there is that the hospitals in that region in Italy are about to be unable to treat people, as hundreds of people are dying every day. The hospitals are at the point of collapse. And that note there about the deaths in Italy now, mirroring the rise in new cases there earlier this month, that's really the whole ballgame. Like if there's a relationship between two numbers or two things or two trends that you have to understand in order to know why all the epidemiologists and public health people are so freaked out right now, as well as the political leaders who get it, it's the difference between those two numbers. The new cases followed 3 weeks later by the intensive care demand. Mark Lipsitch explained today in a piece for STAT about what our options are as a country. Mark Lipsitch is the epidemiologist who runs the Center for Communicable Disease Dynamics at Harvard University. He said today, very simply, in a way that I think is actually memorable and therefore really useful for all of us, he said, quote, intensive care demand lags new infections by about 3 weeks, because it takes that long for a newly infected person to get critically ill. And again, not everybody who gets infected will become critically ill, but the people who need critical care will start showing up at ICUs about 3 weeks after they became infected. So if this is the past month in Italy showing the rise of infections in Italy, we'll add in a 3-week lag time, and that's where you see the rise in hospitalizations. A slice of those same new infections from 3 weeks ago are the people who are now critically ill and needing to be treated in hospital. And that is why their hospitals are collapsing. The steep rise in infections foretells by about 3 weeks the collapse in their hospitals that is happening today. That region's governor, again, saying that we will no longer be able to treat people in hospitals. That is the terrible news from Italy. That's why you keep hearing people talk about Italy like it is the boogeyman in this story. That's why New York officials in particular are sounding the alarm about the mirror between New York cases and Italy, about how the steep rise in cases in New York now foretells a crush in hospitals here coming very, very soon, just as we have seen it play out in real time in northern Italy.